Lipoic acid is a natural antioxidant and anti-inflammatory fatty acid with a number of essential functions, from vitamin metabolism to mitochondrial respiration. Alpha-lipoic acid, or R-lipoic acid, is a disulfide-containing compound found in every cell of the body. Some call it a universal antioxidant. Lipoic acid acts as a powerful antioxidant both inside and outside of the cells. Lipoic acid scavenges several reactive oxygen species. Lipoic acid helps to regenerate both fat and water-soluble antioxidants, such as vitamin C and vitamin E. Lipoic acid improves sugar and fat metabolism. Lipoic acid is an essential cofactor for mitochondrial respiration enzymes that improve mitochondrial function. Lipoic acid exerts a rejuvenating impact on the mitochondria by protecting them against high levels of reactive oxygen species that they produce during the aging process. Lipoic acid also has anti-inflammatory action independent of its antioxidant activity. A healthy body makes enough lipoic acid to supply its energy requirements. Therefore, there's no daily requirement for this supplement. However, several medical conditions appear to be accompanied by low levels of lipoic acid, such as diabetes, liver cirrhosis, and heart disease. In parts of Europe, lipoic acid is approved for the treatment of diabetic neuropathy. It's been shown to enhance insulin sensitivity, improve microcirculation in the limbs, and reduce neuropathic symptoms. Also, lipoic acid produced in the body decreases with age, which could increase free radical-induced damage. Lipoic acid supplementation in animal models has also prolonged lifespan and prevented neurological damage. Lipoic acid is an antioxidant compound found in every cell. Therefore, it's essential for many enzymatic reactions, and it's essential for the normal function of the human body. Lipoic acid neutralizes free radicals and associated oxidative cellular damage. Lipoic acid scavenges several reactive oxygen species. Lipoic acid also helps to regenerate antioxidant vitamins C and E. In addition, lipoic acid promotes the activity of other antioxidants, such as glutathione and coenzyme Q10, which are two essential anti-aging health-promoting compounds. Lipoic acid increases tissue glutathione levels, which otherwise decline with age, by restoring glutathione peroxidase activity. Early studies indicate that lipoic acid is suitable for further study in cancer research. Cell-based and animal model studies have suggested that lipoic acid may inhibit the initiation and the promotion stages of cancer. Alpha-lipoic acid has also been studied for its potential effects on lung and breast cancer cells. In patients with subclinical hypothyroidism, lipoic acid improved endothelial function by decreasing oxygen-derived free radicals. You could check out my video on hypothyroidism for more. The HIV infection. In human immunodeficiency virus-infected subjects with a history of unresponsiveness to highly active antiretroviral treatment, lipoic acid increased glutathione levels and enhanced or stabilized the lymphocyte proliferation. Lipoic acid inhibited cystine stone formation in mice who had cystinuria. Lipoic acid reduced ischemia, reperfusion injury of the liver in humans undergoing liver surgery. In patients with coronary heart disease and those planned for coronary artery bypass graft, lipoic acid significantly decreased the inflammation when blood is removed from the body. Lipoic acid ameliorated the metabolic changes and the pancreatic lesions on a high fructose corn syrup caused pancreatic damage. 3 months of lipoic acid supplementation improved walking tolerance and delayed pain onset in peripheral arterial disease. Lipoic acid ameliorated oxidative stress in patients with confirmed acute coronary syndrome. Takotsubo syndrome is a form of stress-induced heart muscle damage. Lipoic acid improved the innervation of adrenergic nerve cells in hearts of patients with Takotsubo syndrome. Lipoic acid prevented heart cell death and prevented progressive heart remodeling and improved heart function in animal studies. Infections of the upper respiratory tract sometimes result in the loss of the sense of smell. Lipoic acid improves olfactory function. In patients with idiopathic dysgeusia, which is an altered perception of taste, lipoic acid was associated with significant symptomatic improvements. In patients with sickle cell disease, lipoic acid protected a subset of patients from oxidative damage to fat and proteins. A combination of lipoic acid and D-chiroinositol improved clinical and metabolic health in women with polycystic ovary syndrome. Supplementation of myo-inositol and lipoic acid improved reproductive outcome and metabolic profiles in these PCOS women who were undergoing in vitro fertilization. You could check out my video on polycystic ovary syndrome for more natural treatment options. In men with chronic spinal cord injury, lipoic acid reduced fasting blood sugar, body weight, BMI, waist circumference, and blood pressure. Lipoic acid also decreased food intake. Lipoic acid's mechanisms of action are through antioxidant and antioxidant enzymes. It increased glutathione, increased superoxide dismutase, increased catalase, and increased NRF2. When it comes to markers of oxidative stress, alpha-lipoic acid decreases malondialdehyde. It decreases myeloperoxidase, decreases tropon L levels, and decreases NOx4 and P22-PHOX levels. When it comes to inflammation, alpha-lipoic acid has many actions. It reduces both Th1 and Th2 cytokines, decreases TNF-alpha, decreases many interleukins, decreases nitric oxide, among others. When it comes to alpha-lipoic acid improving fat metabolism, some of its actions are activating the AMPK receptor, modestly reducing non-esterified fatty acids, increasing the LDL receptor, and altering PPAR receptor activity. When it comes to alpha-lipoic acid and affecting the cardiovascular system, it decreases endothelin, it decreases AT1, and decreases PAI1. For the brain function, alpha-lipoic acid increases acetylcholine and choline acetyltransferase, and it decreases acetylcholine esterase in the hippocampus. It also increases VGLUT1. When it comes to alpha-lipoic acid and the cells and mitochondria, it increases BCL2, it decreases BAX, capsase 3, and capsase 9 activity, and it increases PGC1 alpha. Some dietary sources of alpha-lipoic acid include vegetables like spinach, broccoli, and tomatoes, and meat, especially kidney, liver, and heart. Available supplements come in doses of between 600 and 1,800 milligrams per daily. Studies have shown that increased dosage is also followed by increased side effects. Oral lipoic acid has a limited bioavailability of about 30%. Studies show that there is a significant inter-subject variability in peak blood lipoic acid concentrations due to individual differences in gut absorption. Urticaria and itching are the most common adverse event, but they're generally mild and go away on their own. Lipoic acid is associated with a dose-dependent increase in nausea, vomiting, and vertigo. Higher doses of 1,200 to 1,800 milligrams have more frequent adverse effects. An oral dose of 600 milligrams once per day appears to provide the optimum risk to benefit ratio. This is particularly the case in the elderly population, where a 600 milligram dose was well tolerated, but higher doses caused intolerable flushing and intolerable upper gastrointestinal side effects. For more information, check out my other videos on powerful antioxidants that would work well combined with alpha-lipoic acid, like my video on glutathione and my video on coenzyme Q10. For more solutions to inflammation and oxidation and their effect on the immune system, check out my videos on antioxidants, inflammation, and on autoimmune diseases. For its role in diabetes, check out my type 1 and type 2 diabetes videos. For improved brain function, you could check out my videos on nootropics and choline sources.